Rotavirus is the commonest cause of childhood diarrhea, and there's a vaccine for this virus. Do you know how many times some mothers receive phone calls from their children's daycare centers and schools because the child is purging and they have to leave the office to attend to the situation? Do you also know that there are some mothers who don't ever receive such kind of calls, and they're not necessarily doctors or nurses or midwives or health workers, but it's something they know that works in their people? Well, today I want to teach you some secrets about the treatment and prevention of diarrhea that you'll be surprised at how easy it is to put an end to diarrhea in young children. Juliana Ome is the name. Diarrhea, home care and prevention is the topic. A child is said to have diarrhea when that child goes to the toilet and the feces is watery, usually 3 times or more in 24 hours. For example, from today's morning to tomorrow morning, if a child goes to the toilet 3 times or more and it is watery, that child has diarrhea. Many things cause diarrhea, but we shall concentrate on how to manage it at home and how to prevent it. There are 4 things you can do at home when a child has diarrhea. Number 1, once you notice a child has stooled and has diarrhea, give the child ORS. ORS stands for oral rehydration salts. For children under 2 years of age, give 50 to 100 ml of ORS solution each time the child goes to the toilet. For those 2 to 5 years, give 100 to 200 ml of ORS. And then for older children and adults, they can take as much ORS solution as they want. ORS is simple to prepare. Just buy a sachet and put it in 1 liter of water. This water is either bottled water that is still sealed, or get clean water, boil it and let it boil very well and allow it to cool. Get a liter out of it, mix the ORS and then give it to your child. You can also make ORS with salt and sugar at home, but ORS sachet is affordable and is available. So every household should have sachets of ORS kept in the house. Don't wait for the children or for your child to come down with diarrhea. It is better to use because the electrolytes that we need to help a child that has diarrhea are in proper quantity inside that sachet already. So there's no need to be afraid of making mistakes when you want to mix sugar and salt and water. You get, so just have the ORS sachets and use them at home. Okay, then ORS should be given to children and infants using a clean cup and spoon. Feeding bottles are not allowed at all. They may even be the ones causing the particular diarrhea episode. So please use clean cup and spoon. And when you mix ORS, make sure you use it for 24 hours only. After 24 hours, if baby is still purging, throw it away and mix a new sachet of ORS for the baby. And in addition to the ORS solution, make sure the baby is drinking enough fluids, because the commonest cause of death in children with diarrhea is lack of water in the body. This problem is called dehydration, and it is the biggest problem with diarrhea. We are more afraid of dehydration than the diarrhea itself. Then number 2, give zinc tablets every day when a child starts purging for 10 to 14 days. For a child that's less than 6 months, give 1 tablet of 10 milligrams zinc every day for 10 to 14 days. For children above 6 months, give 20 milligrams of zinc tablets every day for 10 to 14 days. Then continue feeding the child. For those for children less than 6 months, keep breastfeeding the baby on demand. Then for those more than 6 months who are already taking other feeds, keep breastfeeding and giving other quality feeds. Please, mothers, don't be tempted to reduce the feed you're giving to the baby because baby is purging. If you do that, the baby will get sicker. Then number 4, take the child to the hospital when you notice any of the following I'm about to mention. The child starts vomiting, becomes very thirsty, the child is getting dehydrated, and the child eats poorly or develops a fever or has blood in the stool, or the child does not get better in 3 days, please run to the hospital with that child. Please listen very closely to the tips I'm about to share on how to put an end to diarrhea in children. Number 1, give your baby breast milk only from birth to 6 months. Then number 2, feeding of your baby. Start giving your baby quality feeds from 6 months in addition to breast milk. For example, corn grill, the popular pap, also called akamu or ogi or cocoa. Add soya bean powder to it, groundnut powder to it, crayfish, make it very smooth, add to it, or other baby milk and feed your baby with it. Don't use feeding bottles. Mothers, please never use feeding bottles to feed your babies. They have the ability to trap germs inside that little mouth, and baby will suck these germs while feeding with them. Okay, use cup and spoon. You can also cook potato porridge with fish or plantain and mash it together for your baby. Add vegetables, fruits and eggs to your baby's menu, and the baby's body will be super immune against germs, both the ones that cause diarrhea and the ones that cause other diseases. Give your child locally available foods. For example, in eastern part of Nigeria, there's a popular food, African breadfruit. Its native name is ukwa. Ukwa is very nutritious. It is naturally tasty, soft and delicious after it is cooked. That can be given to a child. Whatever part of the world you are in, there are foods there that are baby friendly. Make use of them. Again, give your child foods and fruits in season. Some parents don't know the value of seasonal fruits. Aside the nice taste and freshness, any food and fruits that grow in a particular season, nature has its reasons for making them available to us at the time. That is a good time to eat it. For example, fresh corn, local pears, avocados, mangoes, cashew fruits, and pawpaw. Once your child is above 6 months, let your child have access to these things. They will nourish and build that child's immunity. And gradually introduce the family feeds to your baby so that you don't struggle with weaning the baby off breast milk. Make your child's food tasty and healthy, and your baby will be jumping up in good health. Remember, your child's immunity is not strong, so the child depends on you as a parent or caregiver to build up their ability to fight off germs. Next point, use of safe water. The importance of clean water at home cannot be overemphasized. For those who do not have potable water supply at home, fetch water and pour in clean containers. Keep them in storage containers and cover them. Don't allow animals or children to drink from it. Use another container with a long handle to take water from it so that hands will not touch the water. And make sure that every day you empty the storage containers and rinse them off. Another point is hand washing. All the germs that cause diarrhea can be spread by hands that have been contaminated by feces, and these germs can be taken care of by proper hand washing using soap and water. After using the toilet, wash your hands. When you clean your baby up after the baby poos, wash your hands. Before cooking, wash your hands. Before feeding your baby, wash your hands. When you come back from work or your daily activities, wash your hands. COVID-19 is not the only disease or infection that can be prevented by hand washing. And also teach your children the habit of frequent hand washing. Next point, ensure food safety. Food safety means to protect your foods from germs. Do not give your child raw food except fresh fruits and vegetables that are peeled off and eaten immediately. Cook your food until it is hot throughout. Protect foods from flies and cover them properly. Keep your cooked food separate from the raw food, and then wash your plates and cups and spoons and cover them from flies. Then the last point, immunization. Immunization. I saved this for the last because I need to make emphasis on it. Rotavirus is the commonest cause of childhood diarrhea, and there's a vaccine for this virus. Give it to your child. Measles vaccine is also very important. Give it to your child. Meanwhile, don't do pick and drop with vaccines. Give your child all the vaccines according to the child's age. Parents, once your child is immunized, you have put a strong lock on the doors of your child's body, and those germs will not dare come close, because soldiers are at those doors waiting to kill them off. Vaccinate your child and protect your child. Get to watch my health talk video on childhood immunization and get more knowledge. By way of conclusion, knowledge makes the difference between a healthy child and a sick child. Parents, when you have the right knowledge, you struggle less with the care of your children. I love you all, and I remain your favorite health talk personnel on YouTube. Click on the like button if you learned something from this particular health talk, and use the comment section for your questions and your comments. And of course, subscribe.